Yeah. My watch. Okay, thank you.
Plans.
One more time, just one more round. Okay, good morning, everyone. Okay, I'm Dr. Gladys Completo, and I'll be hosting this event. So I would just like to introduce PAASE. So PAASE stands for the Philippine American Academy of Science and Engineering. It's a nonprofit organization composed of scientists and engineers of Philippine descent who have distinguished themselves in scholarly and research-related activities. And it was founded in the U.S. state of Indiana on April 23, 1980. And so far, we have more than 700 members. And PAASE aims to promote the advancement of science, engineering, and technology. We also encourage collaborative work among scientists and engineers in research and development through scholarly and scientific endeavors. And one of our advocacies is to have these webinars. We have bi-weekly webinars on anything about the advancement in science. And we also have weekly webinars on innovations here in the Philippines. So we are very honored to have um, a distinguished speaker, a distinguished guest this morning. And she's actually a very good friend of mine. And now I would like to introduce her by showing the next slide. Okay, so and next slide. Okay, so Miss Lissa Aspiras Wang is my classmate since high school, and we were also classmates in college. So she is a UPLB chemistry alumna as well as a Philippine Science High School alumna. She has an experience of 33 years working in industry, specifically in analytical chemistry and informatics technology. She is well versed in chromatography with a wide range of applications, and you will learn more about this today, as well as experience in the research and quality environments. So she has more than 33 years of working in and with compliance. Lisa has been working with water since 1998 when she started to be a Millennium Empower trainer in the customer education department. She also took several roles, including technical service and global service and support for informatics. And currently, she is a part of the informatics business development team, supporting the informatics sales team for Empower New Genesis Informatics portfolio. So without further ado, I would like to welcome Ms. Lissa Aspiras.
Thank you. Can you guys hear me?
Yes.
Okay. Thank you very much. So I am honored that I was chosen to speak with you today, and I'm very much happy that I have this opportunity to share my experiences in the informatics world of chemistry. So thank you again for PAASE for inviting me. Would you be able to share some slides? So my talk is very short. It's just a matter of talking about my experience in the informatics. In case that you are not familiar, we will talk about what is informatics. Yes, thank you. So in the next slide, yes, we will talk about informatics, what it is, and we'll cover some technologies in informatics. Some of them would be your chromatography data system. Some of them would be talking about LIMS and other applications. At some point, we'll talk about what could be the future like, and we'll have some time for question and answer. So on the next slide, I just want to introduce further my experiences. And as Gladys has mentioned, we've been classmates since high school and close friends. So my experiences have a very broad application. It's usually in the analytical world, and I've handled different types of molecules. Some of them were small molecules like pharma type drugs. Some of them were larger molecules like proteins and DNA. I was even in a company that worked on the DNA mRNA antisense research so ahead of the time that it was not even viable for us to have those solutions at that time until at this time where we have our applications of using mRNA for our COVID vaccines and other vaccines. So as you can see here, I've done some different roles, and I currently am an informatics business development solution person. And what that involves is that I do have a territory, and I talk to our customers on a usual basis to get them exposed to what are the different applications we have that involves informatics. Okay. So we're going now to the next page and talk about what is informatics. So basically, informatics is simply the way we can apply computer technology, whether it's hardware or software, to be able to have or harness the power and possibly transform our data that we collect in the laboratory so that they are usable knowledge for people. So this is the way we're moving in the future. We're trying to digitalize our data. So imagine a world of paper. If you have paper, okay, if you need to find a file, how do you deal with that? Well, hopefully you have a filing cabinet. Hopefully it's organized with different folders, and you have to find which drawer, which folder you have to open, and then go page by page by page to find the information you need. And it's a very manual process. When you digitalize information, this allows you to actually have a database of information that you can easily search. So now, in the past, if you have paper, you may not even realize that some data have been produced and you do not have to duplicate it. But then without the database, you would end up duplicating a lot of data. But with the database, easily searchable data could allow us to reuse the data that we collect and be able to make better use of the data for trending, for analyses, for statistics. So there's a lot of ways of being able to utilize the data once they are digitalized. When you have companies that do have compliance requirements also have these ways of digitalization. So if you have your data digitalized at this point, it's much easier to present data when an inspector comes to your facility and says, I would like to see these files or these data sets. Imagine if you don't have that, you might be going back to a warehouse of filing cabinets and folders, and that's a lot of work. So then your inspection can take a lot longer. With the searching of digital data, it's much easier. So let's move on to the next page. We're starting off to talk about the different types of technologies, and we're just going to recap history here. So some of the pictures you'll see are some chart recorders or even the integrators. So those are the first two pictures you see. In the 1990s or even the 1980s, these were the ways of collecting data. I remember being a young chemist at that time, and imagine running out of paper. So then you now have no results coming out because you did not anticipate having a roll of paper that will last for the whole analyses. So you'd hurriedly have to go back, reload a new set of roll just to be able to preserve the data. You may lose one injection or so. We also can see some pictures here. There's a comic in terms of the FDA because most times there's a need for compliance. In the United States, we have the FDA, we have certain regulations from USP, and you can see that there's some different types of requirements from different pharmacopoeias. We also have the consolidation of the requirements with the harmonization with ICH, okay? And somewhere down below, we have some icons here that show you, for example, networking, being able to show you the ability to now move to the new technology. So I'm just showing you here some examples of where we're directed. And some of the logos you see here are those tools we use in the typical laboratory to make sure that we have databases, to make sure we have ways of rendering data to our customers or to our laboratories. So these are different ways, and these are just a small amount of technologies that we use at this time. And these technologies grow and change in a matter of in our years and decades of growing in the informatics technology world. So today we'll cover a couple different ways of seeing our informatics technologies in the laboratory. And you see here a list of those. So we'll get to start covering. We'll start with a chromatography data system. So we'll move to the next page, please. So chromatography data system is how we actually be able to analyze data. So if you are an analyst in the lab, you're a chemist, you prepare your standards and your samples, and you might be running chromatography systems like liquid chromatography, gas chromatography, mass spectroscopy, any of these types of technologies and other various combinatory type technologies, you will see that there needs to be some type of software. So instead of using those chart recorders or integrators, we're now moving to collecting data in a network environment. So we can run, process, and print those data. We can easily do it from any portal that you have, meaning you can be on a desktop, on a laptop, on a tablet, depending on how your network is set up, okay? And because of this way of having a consolidated database, it also allows administrators to secure the data, because as we know, if this data is lost, how would the company be able to present the data? So if you had paper, if you lost that piece of paper, how would you be able to prove that that analysis has happened? So now we need to secure that data as a digital set of data. And that's what inspectors or any kind of compliance organization for auditing would be looking for. Some of these could be hosted in the company servers. It could also now be in the cloud. As we said, there are different types of technologies at this time. I've also included some logos here of different companies. So I'm not just centering on Waters with the Empower software, but we also have other competitors. And these competitors are also as good as what we have. But as you will find out, Waters has been leading this effort because we have been the first and ever only fully compliant ready software, which means when you have some compliant requirements, you can set up your software to be able to have full compliance according to the regulations of 21 CFR Part 11 or other regulations. And this gives us the ability to easily search and trace those data with full audit trails to be able to justify that the work was done and it has been secured in a way that there's no tampering, there's no ability to lose data. Okay, so these tools that we have in the network world for the software enhances those abilities to allow our compliance boards and compliance auditors to ensure that the companies are doing what they should be doing and that there's no falsification of data. We also have ways of integrating it, different sample preparation technologies, robotics technologies. For example, we have an Andrew Plus technology that we have harnessed to be able to do all the dilutions. So as you can imagine, a robot can be programmed to do all the preparation, the dilutions, and all we need to do is take that, or the robot will take that plate, put it in the autosampler and run. So we, as chemists, do not have to introduce the errors that we could, because of course we could have user error for not being able to pipette properly, not being able to look at the weighing balance and make sure that we're measuring the right weights. So all this can be automated in a way. We've got filters, we've got different technologies for sample preparation, for desalting, for purification, and so forth. So all these new technologies and chemistries can be all combined with our CDS, or our chromatography data system. Next page, please. Now, outside of the collection of data as an analyst, there's a lot more that we have to look into. You might have samples being managed Okay, so you might have a sample coming from an outside laboratory or an outside agent. It could be a CXO, you're the one analyzing for some company, for example, as a client. Or you might be just looking at internal samples being submitted. So you need to manage those samples, being able to track those specifications for each of those samples. These are different types of examples of digitally, so types of technologies where we can digitalize. So instead of having to log, now we have barcoding. So through this sample management, you can then print out barcodes, slap it onto the vial that you're analyzing. And as you actually do all the analyses that you need, whether it's chromatography, data collection, or other technologies or chemistries, you can then be able to track all those analyses and eventually produce a report as a certificate of analysis, all digitally done. So then there's security of the data. There's enhanced, making sure that the data matches your specification. There's also workflow management. So the chemist doesn't have to think anymore and say, where's that SOP? That workflow can then lead them to the next item that they need to do. So these would then be set up such that the chemist would then know exactly what they need to do, where they need to go next, whatever the workflow might require. Because as you will imagine, every company out there, they have different requirements, even from the same, maybe you have a generic drug company, you're analyzing paracetamol, biogesic, and you're just doing the same analysis as other generic companies. But even so, you will see that these types of analyses can be slightly different just because of the way the workflow and the requirements are. Maybe one company would require certain identification tests. Maybe there's a different way of identifying for another company. So whatever the analyses are. We also will integrate with the instrument. So this is talking about your CDS or your chromatography data system or other types of technologies, making sure that you don't have to handwrite or you don't have to copy and paste from one technology to another, those data. This will eliminate any kind of error transcription. As you will imagine, we as humans are very much prone to errors. We can be looking at the same numbers again and again, not seeing that we've switched numbers. Or intentionally, okay? So we hope there's no intentional falsification of data at all, but you can never tell, right? And me, as I have experienced doing some support roles, there has been some calls where they would then present data that does not match what was reported, and those reports were not digital. They were printed off and written separately. So then we ensure if you have everything digitally and connected with your CDS, then there's much more security and enhancement to allow you to make sure that the data you're reporting has come from the right source and never changed. There's no way of having those errors. And as we were talking about compliance, you have easy access to that data for searching. So then you will have a very smooth inspection, for example, or auditing, okay? Now, all this data will accumulate. You've got to manage that data. You need to make sure you have a centralized location of all that data. And what we're talking about here is that so that if the data is lost, then you have some trouble when you have some inspection. So we cannot lose that data. We don't want to have that data lost. So, and the main purpose of that is for easy searching and reusing, as we talked about. This is a world of your managing your information, not just on the actual HPLC or UPLC that you're using, but you're now extending it to everything that touches your samples. Everything from the submission all the way to the reporting of your COVs, everything from ensuring that you have data. So our digitalization of all this data is quite critical to allow us to have secure data everywhere. Next page, please. So because we need to also further have instruments instruments or ways of connecting our digital data to that laboratory information management system, the LIMS that we were just previously talking about, you might rather have a tablet. I don't have an example tablet with me, but you might want to have a tablet. So before, we would take a notebook, open our notebook, go to that page, start documenting what we're doing, whether you're doing a new research or you're doing some predefined quality type analysis based on a method. Any of that, from the very basic of starting from scratch on the research project, all the way to a quite defined analysis in a quality control laboratory. All that can be documented instead of opening up your lab notebook, and instead opening a new page as a document in an electronic lab notebook. So imagine if you have that physical lab notebook, and you now have different notebooks for different purposes. If I was an auditor reviewing some work, I would have to go from lab to lab, look for which lab notebook, okay, maybe it's hidden under pages of paper or some other lab notebooks in somebody else's desk because they're reviewing it previously. So then I have to go around, look for that notebook, find the actual page, open it up, and then I can review the data. Imagine sometimes you waste such a long amount of time. I remember being a chemist, reviewing data for our FDA, NDA submission for stability data. And I would spend like 30 minutes just working around the whole laboratory from desk to desk, lab bench to lab bench, just to find that one lab notebook to say, yes, the instrument was calibrated today. Because maybe we need to document that in a lab notebook. When you have an electronic lab notebook, it's as easy as logging in and searching, because then you have everything within the database. Okay, and we now can integrate to what we were talking about previously, your LIM system and your CDS, because now everything's connected. So the data that you write in your official physical lab notebook or in your electronic lab notebook can now be enhanced and brought in. So if you were weighing a weight in a balance, usually you would write that weight so you can calculate the concentration. Instead, now we can have automated connection from your balance to press a button and have that input of that weight directly into your lab notebook, in your electronic or ELN. And when that lab weight has been written in, now you have a form you can open up in your electronic lab notebook where it calculates automatically that concentration. So instead of having to take our calculator up and say, let me calculate that concentration because I did this serial dilution, and writing it in your lab notebook and having that reported there, now you've got an automated way of using an Excel spreadsheet as a form that could be locked. Okay, and you can then enhance and make sure that the calculations are accurate, because then you have lesser hands-on, no possibility of transcription error, and everything's calculated for you. So it enhances that communication and that connectivity within the lab. No more Post-its. Those are not allowed, right? As you can see, there's a picture here of Post-its that I included. Moving on to the new page. Thank you. New slide. So there's more into this environment. We talked about managing your data, but I want to make sure that we highlight that this is a critical piece of your informatics digital world. But there are other things that we can talk about here too. Managing your inventory. Inventory of what? Which instruments you're using in the lab. So you can have ways of looking at, and it's not just saying, I do have these number of instruments. It's a matter of also connecting it with your instrument management. For example, has it been maintained? Has it been calibrated? Or whatever the requirements you have. Whether it's a weight balance that you have weight verification on a daily basis, or you have a maintenance plan for your HPLC or UPLC or any other devices you have in the lab, like a pH meter. You do your pH check with the standard. That can all be part of the instrument management inventory. But then that's not the only part. You've got consumables. We're talking about standard solutions, your samples, your stability samples. We'll get into stability management pretty soon. Your columns, your actual solutions as buffers. So you prepare a buffer. You can then identify and put it in and connect it with your ELN, because as you're preparing, you can document in your electronic lab notebook. But all that documentation will end up be part of your inventory management of that solution. So that as you will have an experiment later on, you will then select which solution you're using, and it will tell you if it's fit for use. Same with the instruments. As you're using the instrument, you select that HPLC that you want to use, and it will tell you it's fit for use. If it's not fit for use, it will give you a warning. It says it's due for PM, and that tells you you cannot use it, because then your data will not be according to compliance. So if there are compliance requirements in your company, perhaps these are typical for laboratories. Whether you're looking at small molecules or large molecules, it doesn't matter. Everything you use in the lab has to be tracked. So even those standards you prepare, how long can you use that standard? You might have to do some testing on that solution to make sure that it's stable according to however you stored it. And that gets into stability management as well. Okay. So all the supplies you have in the laboratory, even your columns, every injection in the columns for certain waters instruments has a tag, a column tag, that allows us to track every injection we've ever done on our columns. Can you imagine? You can go back in time and say, I've run those standards before. How does it look? So then you can look at the data and compare it to what you've done using the same column with the same serial number, because we track all that. Now, not all our HPLCs in the world can be tracked, but water specifically have certain technologies for both HPLC and UPLC, not just UPLC, but we have certain technologies for certain instruments that allow us to track it. So there's radioactive tags that we include with every column that we sell nowadays. Okay, stability management. This is also where we have a lot of ways of defining how stable a drug would be or a solution would be. And it doesn't have to be just a tablet. It could be a capsule, could be an ointment, a cream, it could be a patch, it could be microspheres, an inhaler. Any of that can be tested for stability. So this is usually done by a company so that they know whether or not what expiration to put in. I should have brought a Tylenol or biogesic bottle with me and say, there's always an expiration date. And you always have to look at that date, because those have been tested in laboratories to make sure that when you take any type of drug or, medicine, that they are good for use. Otherwise, what if there's a lot more impurities, degradants? It's not effective anymore. You're not going to get well. So these types of work has to be done electronically in a stability management program, where you create cases, stability studies. You define which locations, basically which stability chamber you're going to put these samples, and for how long before you retest it. Maybe you're testing on a long term, 1 month, 3 months, 6 month, 9 month, 12 month testing. Or maybe you have a short-term drug, 1 hour, 2 hour, 3 hour, 5 hour, 6 hour, 8 hour, 10 hour, 12 hour, depending on the type of, medicine that you're testing. Some lotions, we have them in our desk for years. Some medicine, we want it to be fast acting. So that's just within minutes or hours. So these types of storage can be electronically tracked. So then now you can pull up a study and say, these are all the results. And we show from that analysis, we click a button, analyze it, and say, here's our predicted expiration dating. Okay? We don't have to use a statistical software to say, what is the expiration dating by calculating by hand. We have it integrated with our stability management system. And then lastly, we have here data analytics. This is a very much actively growing type of informatics technology. It is growing because the types of tools we use are changing. When we started on data analytics, we're using very crude software. Now it is so advanced that you can then show your data so many different ways, different kind of mapping, different kind of charting, so that now what we want is to have a visualization of our humongous amount of data we collect. Remember the data management, we collect data all this time. Now we can look at trending. We can use that data to allow us to have better decisions, to have us understand exactly, to gain insights and understand, is this good? For example, our column inventory management can be integrated with data analytics. We look at all the analyses from a certain serial number of a column, and we see that it fails at the 500 injection. So then we do more analysis on similar columns of the different serial numbers, and we keep on seeing the same trend. So then we can then make some assumptions and say our column can be used up to 450 injections or 499 injections, because it's consistently after 500 or so, it fails. And we do not want to have those investigations when we have data that fail. Our OOS, or out of specification investigation, because the column we were using had failed already. So to avoid that, we track the usability of the column and say, now we can identify the column has to be used this number of times before we throw it out. Because we do not want to have that risk of having important data being analyzed. And maybe your samples are a one-time analysis. Then you cannot reanalyze anymore. And it's a time constraint. That critical data analysis has to go on without any failures. So then it's most critical to make sure that we know how long these standards, these solutions, these consumables like columns can be reused before, we have to throw them out. So this enhances lab productivity, ensures that we have a good workflow, so that we have good operation in the laboratory. We don't have to rely on asking, sir, ano po ba? Ginamit niyo po ba ito? Kailan po last nagamit? Sino po gumamit? Anong analysis? Hindi niyo na matrack. Ito, matatrack natin lahat. Connected lahat yung data na yan in the same database. We can track exactly sinong gumamit, anong analysis, anong buffers, kahit anong ginawa ninyo. Alam, para walang sabit, walang problema. Walang, ay nako, hindi ko alam, ano bang gagawin ko? That question should never come up, because when you have critical analyses to run, here's something that you can put in as an example. We have analyses that are neonatal. What is neonatal? Yung mga bagong panganak na babies, they don't have all the ways of getting sustenance. So then we have to give them all these drugs to make sure that they can grow to a point that they can be brought home. Now, neonatal conditions, what if your analysis has failed, and then now hindi nyo alam, nabigyan ng multiple dose na higher yung dose yung bata, nako, namatay. That's how critical it is, because that window of the analysis has to make sure it's within the specifications now, because of the size of the baby, the age of the baby, so many considerations that clinical results will determine kung ano yung bibigay na amount of drug to that baby. And kung sumobra o kumulang, kung kumulang hindi gagaling. Kung sumobra, pwedeng mamatay. Or pwedeng mamatay kung kulang kasi hindi enough yung nabigay. So it's so critical na, because it's clinical data, that we have to be so sure na maganda ang ating analysis at sigurado. Sorry, nagtatagalog na ako. Hopefully that's good insights for you. How this whole informatics world can help enhance and make sure we have secure data. Manage this data, look at the trends, look at how we are using this data, and be able to make sure that we have inventory and stability management included. Sige po, next page. So now we're talking about what could be our future. I have here a picture, a simple picture of a desktop, Mac na yan, and basically the room of this person, because with the hybrid work we're working, because of COVID, we enhanced our usage of technologies. We now can be in a different place and still have our instruments running. Nako, sorry po. I forgot my other phone. So we are actually in a world where we're showing our technology as usable, so we can actually be logged in anywhere now in the world. Even I myself can log in, and we have monitoring software. So we have something called our system monitoring software from our Waters Connect from Waters. So I show this to our software for our software customers, for example, in our lab, and say, look, in your hybrid world, magsimula ka sa lab, you run your system in the lab because you want to be close to your instruments, you're putting your files in. But the moment you start to run, you don't want to keep on going to the lab. You could go home, be working from your desk in your house, and still see the progress of your run. Now, of course, sorry, Bob, I don't know how to turn off this phone. I have to turn it off because, sorry. I don't know, Paul. Sorry, Paul. Anyways, I will continue here. So we are talking about you can be at home and seeing the samples and the instruments being run so that you actually are showing that your progress is still good. Now, the moment that may failure, siguro nag-leak yung instrument. Of course, you're not in the laboratory. Then you can easily call somebody in the lab and say, hey, nandiyan ka ba? Pwede mo pa-check? Sabi ng system ko, nag-leak na siya. O, na-confirm, may leak nga dun sa may column. Oh, sige, I have to go back to work. So that you have to be by the instrument. But the rest of the time, you could be sitting in your house, in your deck, holding a margarita maybe, and seeing that your progress of your run, doing some data crunching, because now you can look at all the data that's being collected and analyze it even without being in the lab. The whole network of having your data, especially if it's in the cloud, maybe malakas ang Wi-Fi mo sa bahay, as long as malakas yung Wi-Fi mo, okay ka, diba? So our laboratory is moving to a digital world where we don't have to be in the lab. Even from the start of sample preparation all the way to analysis. You can have that all automated in a way. Even approval of data. When you're actually producing data, you have to have review of someone. You have to bring it to somebody else. May manager, merong, peer review manager, merong quality assurance group. So all these types of, usually you walk around with your notebook, pa-sign po, pa-review po. Here, you can just send an email, or you can have clicked the button to say, send that notification link, the notification received by the person who will review. They get that email, they click on the link, they review the data, they click and sign in, they sign off electronically with that signature. Nandun na sa system, may audit trail, kompleto. And now we're able to actually see that the data is now included in a form, for example, as CFA, because now i-release na yung batch ng data because you're doing commercialization. Ngayon, nandun sa warehouse, nag-iintay sila. All you have to do, nasa bahay ka, click that button, nakuha na lahat ng data, isa-send na dun sa na-release na with signatures electronically. Everything's traceable, everything's searchable. So no question asked, because now you have everything integrated electronically. So now, what happens to us chemists? Us chemists, we spend more time doing more important research, more important science, doing the groundwork for finding better methods, finding better drugs, doing all the specific sciences that we need to do, so that the laboratory for analytical chemistry is done in an automated fashion. Diba? So you actually can spend more of your brain work analyzing and looking at those trends and making those critical decisions to say, when is it viable? When is it expiring? When is it stable? Until when? Okay. When do we have our systems to be usable? Because we have inventory management. All that decision making is done because of the data being presented to you from the informatics world. So now we enhance our usage of the informatics world so that you don't spend hours trying to calculate all that data in your lab notebook, trying to cut and paste into your lab notebook, or trying to be able to walk around looking for which lab notebook, which folder has those data to accumulate it to create a CFA. Nako, sir, nasa na po yung data? Hinahanap po namin. Ay, naku, absent si ganito, wala po yung data. Naku, paano po yun? Tatanungin natin, kaso wala siyang may sakit po, nasa ospital. So you don't have ways of getting all that data together. Now, if everything's electronic, you know the sample ID because you've got it. Maybe it's even barcoded. You scan a barcode, you have everything presented to you in whichever format of form or template that you need to move on. You don't have to rely on looking for that person, tapping that person's shoulder, making sure that they are present, they're not absent. Kasi kung absent sila, paano na yun? Nakalock yung kanilang office, nandun yung lab notebook, hindi natin tuloy ma-review, hindi ma-release yung batch nandun sa warehouse. So paano na yun? Sayang, oras, millions of pesos, millions of dollars are being wasted for products sitting in a warehouse not being released. Now, if you have everything electronically, ang bilis. May workflow kayo, ang bilis kasi may process, walang mistake. Yun ang aking kwento. Yan ang kwento po natin sa informatics world. And you never know, ano pang future natin. Mamaya, meron ng robots na gumagawa ng lahat ng trabaho natin. So that we have time, di ba? To do everything that we need. Next page po, question and answer. So again, po si Lissa Aspiras Wang, nandyan po yung aking personal email. This is a slide. So, any questions po kayo na ma-present? Ayan po. Email ko personal. Meron din po ako sa Waters. Pero if you just want to reach out to me for my experience, it's lisa.aspiras@gmail. I kept my maiden name in my email. But if you want to reach me for more Waters-related questions, kasi di ko naman masyado sinabi ang Waters today, Lissa_Wang@waters.com. So Lissa_Wang@waters.com. Yun po ang email ko. So questions po.
Okay, thank you very much, Lisa. We have a question here on the chat box. I just read it? So this from Ruel Nacario. Question for the speaker, for you, Lisa. Can laboratories utilize legacy systems or older Waters instruments and effectively integrate Waters Empower and new informatics tools? What is the oldest instrument compatible with these informatics tools?
Ako, magandang question yan. Marami kaming customers, ganyan nga yung question sa amin kasi mahina yung turnover of instruments kasi alam nyo, galing ng mga, especially Waters instruments, mas marami sa amin na very old instruments, umaandar pa rin. Actually, nung chemist ako sa lab, yung first company ko na na-join sa States, because I was so junior, binigay sa akin yung pinakaluma na instruments. Nakikita ko yung bago noon, HP 1050. Bago na yun noon, kasi 1990s yun. So, binigay sa akin yung pinakaluma ang ingay na Waters instruments. Naku, alam niyo ba? Without using a hammer or an axe, all other tools of preparing the wrong, trying to destroy the instrument purposefully, para bago na yung aking instrument, hindi ko nagawa. Matagal siyang gumagamit. So, ganito yan. Sa aming world sa Empower, meron requirements kung how far back we can go. And ang guideline namin, pag 4-digit yung model number, pwede siyang makonect. Pag 3-digit siya, yung mga 996, 998, 486, yun medyo hindi na namin makakonect kasi yung type of connection niya is iba. Ngayon, we're working on Ethernet-based connection para ensure na yung data collected from the instrument is transferred to the software and it is secured. So because of the changes in technology, because ngayon, I doubt kung makabili kayong computer na merong COM port. Wala na yung mga yan, serial COM port. Di ka na makabili ng mga computer. So, and then the operating system nag-advance. Mas mabilis ang advance ng Microsoft. And we have to follow that trend. Mabilis ang advance ng Oracle. We have to follow that trend. Because of those, some certain instruments hindi mo na makonect. Pero may ganito pa yan. Kahit na hindi mo ka makonect sa Empower, kunyari, kasi legacy instruments na siya, whether Waters or other instruments na serially collected, meron kaming tinatawag na SATIN. It's Satellite Interface Boxes. Ang tawag doon analog to digital converters. So ang analog data, ko-collect niya, i-convert niya to digital, nasa Empower na. Hindi mo lang masabing makontrol yung method ng paggalaw ng pump, Kanyari, pagkalaw nung ipoprogram mo directly to the instrument. Pero yung chromatography, yung mismong peaks nyo, nandito na sa Empower. So ang inyong integration, ang inyong peak analysis, yung concentration reporting, lahat po yan, integrated with Empower. So kahit na hindi mo siya makonect na makokontrol may instrument, pwede pa rin makolect yung data. Ito pa, ang mga informatics tools namin can go back so far. Meron nga yung mga instruments na sinasabi nila na, alam niyo yung mga LPT port, tagal na to ha, baka hindi na nga alam ng mga bata ngayon. Yung mga dating printer na ang galalaki na gano'n, pwede pa nga yung makonect. Pwede rin yung mga serial COM port. So yung mga connection na yan, pwede pang makuha. Kaya meron kang balance na merong 9-pin na serial COM port. Meron kaming device, called the Timpo device, na ma-convert para yung weight ng balance mo, ma-connect para automated ang pasok sa electronic lab notebook, sa integrated LIMS system, sa laboratory information management system, para lahat captured electronically. Kaya, alam nyo, kahit na luma, kaya pa rin.
That's nice to know, Lisa, na pwede pala if you're using an old software, we can still connect with the new updated
Old instruments to newer software.
Because we have that experience where we're using Unify and now they updated it. We have now Waters Connect installed in our computer. So there you go. It's still, we can still connect. We don't lose our data. We can still get the updated data. Yes, let me hear from Dr. Giselle Concepcion. Thank you, ma'am, for being here. And then after that, Doc Billy Cabellion.
Thank you, Gladys, and congrats to our very, very experienced speaker. Magandang usapang chemist at biochemist dito because we are users of HPLCs and LCMSs in the lab. And that's really been my challenge all this time. Well, until we got the Shimatsus, and I think we have at least one Waters, but the HPLCs. And we also have the Agilent LCMSs, the high res and the low res, no? And well, automatic na talaga yung data acquisition and analytics in these instruments. But I think your Empower Waters might be the leader. So congratulations and thank you for making it compatible with other brands, no? So when I was once UP Academic Affairs and Research Administrator, that was my dream. As part of EUP, the fifth important area of electronic EUP would be the academics and research. And the ideal was to follow what other universities in the United States and Australia do, which is to secure the data of our laboratories as basis for data research quality verification, and also eventually for patent application verification, which would require the scientific due diligence, at least a kind of an audit, right? So, well, I'll just tell you what my RAs were asked to do. They were still doing their lab manuals, lab notebooks that they would carry around and write on, but then they were required to paste printed data from the instruments, no? So then I thought maybe that what would be good is to make it completely electronic, and then to have the supervisor sign the data for verification. But then you know that is really very difficult to implement at this point in in the Philippines. But we're getting there. Now, my question regarding this is, to what extent would you be able to secure the data privacy of these data? And how would you secure it from hacking? And then thirdly, how would you now train or educate the higher-ups, the managers, in the proper use of the bioinformatics in the laboratory? So that's already a complex question. There are many others, but I will stop there. And well, we will hear important questions from our audience as well. Thank you.
I'll answer po in the point of view of our informatics products in Waters. So ang Waters products po is sitting in an Oracle database. So not to get too technical, because it has an Oracle database, maganda pa ang security. So because it's secure, wala kang possibility of mishandling or tampering, because you have to, kahit ako na Oracle, Oracle administrator and Oracle certified professional, hindi ko alam paano ma-manipulate ang Oracle metadata para ma-change siya, di ba? So talagang it's in the security of Oracle that we have good enhanced protection for the data. So ang privacy is all a matter of, kasi syempre, kailangan sino lang makaka-access. So meron yan mga requirements kung paano ma-access yung data. So meron siyang ways of installing it in, let's say, yung hosted server nasa using VMware or maybe nasa cloud. Tapos meron kang portal, meron kang either you're using Microsoft, Azure, or in the cloud, or maybe you're using hosted servers like Citrix applications. So there's different applications that allow you to render a host, okay? So meron kang parang client ka. So maglalogin ka sa computer mo, meron usually yan username, password. Ang mga yan, secured yan in a way, for example, in Empower, if you put the wrong password X number of times, you can be logged out. May mga ganung possibilities of security. They even ensure that it's connected to group policies and domain activities. So pwede nga linked yung user account to company IS user accounts na sa operating system. So kung kunyari yung username mo ginagamit mo to login in your operating system as you log into the computer, yun din yung login mo. So as long as you don't share your username and your password to other people, meron kang access na very secure. So privacy, wala kang username, wala kang password or hindi ka makakapasok. Now you'll say, wait, cloud, nako. Parang nakakatakot yan nung una namin nadinig na ilalagay na yung mga data ng mga customers to the cloud. Pero think of it as a tunnel, okay? Similar to a VPN, a virtual tunneling system. Meron kang parang tunnel from your computer to that server through the ways of connection na pag wala ka dun sa tunnel na yun, hindi ka makaka-access. Example po ninyo, bank account ninyo. Tingin po ba ninyo secure yung bank account nyo na walang nakakakuha ng how much money you have and what access they have? Hopefully, walang nahulog na tape backup dyan ng bangko, no? Kasi pagka gano'n, di meron ng possible security infiltration. Pero kung wala, di ba? You have confidence that when you use your phone, you use your tablet, your computer, you log in to your portal, your user account, your password is secure, kayo lang nakakakuha nun, walang iba, di ba? Unless na meron ng possibility na infiltrate kayo na whatever. So hopefully walang ganon. So as long as that's secure, you have data being secured and you have your own privacy to your data. Walang halo-halo yan. Like you don't see other people's accounts. Ganon din sa data ng mga customers namin. Kasi you create these tenancies. We call it tenancies sa cloud. Even though we share the same server, for example, we have Amazon hosting with lots of servers around the world. May global data ka dyan. Ilang companies yan, like the big 30 companies. Nagsabi ka ng Pfizer, J&J, lahat ng mga big companies, no? Lagay mo sila lahat, BMS, tapos nandyan sila lahat ng mga data nila, malalaki mga server. Pero, anong nangyari? Kasi meron silang tenancy, yung data nila lang ang ma-access nila. Yun ang kagandahan nito. Now, because you were saying, yung lab notebook, yung inyong mga staff, kukunin nila yung notebook, magka-handwrite sila, kina-cut and paste pa nila yung results nila, nalagay nila tape, tapos signature lang sa may tape para nasabi na secure doon, may date pa, no? Yun very manual process. If you move to electronic lab notebook, you're holding a tablet or you're using your lab notebook as your computer, whether it's a desktop, laptop, or tablet or phone, and you're entering data there. automatically. You're actually even connecting to a balance or a pH meter to have those data entered automatically. Your chromatography data from your Shimadzu. Ang kagandahan ng waters nga, ito. We are not concentrating on only waters HPLCs. We open it to different vendors. And it's the vendors' opportunity to include all their HPLCs or their mass specs and however they want to connect with Empower. Sila ang nagde-decide kung anong instruments nilang, kaya kung meron kayong instrument, hindi nagko-connect sa Empower, sabihin nyo sa kanila, pwede ba ilagay nyo naman sa Empower? All they have to do is create instrument drivers para lang ma-read ng Empower. It's makulit na data, ma-analyze. So
Lisa?
then, lahat ng data in one place, in one secure database.
Okay, Lisa, thank you for that. So, yeah, can you hear me? Actually, Billy Cabilon, Doc Billy Cabilon actually asked this. So, Billy, would you like to ask your question, which is Lisa already partially answered that you're using Oracle. Do you have a follow-up question, Billy?
Yes, ma'am. Thank you very much. That's a very interesting presentation. Just the other day, I was looking at the metabolic pathways in the human being, and there's so many. So here, we're trying to integrate all these chemistry data, how they are stored, acquired, analyzed. So I just ask a simple question. What technology backbone are you using? Is
Technology
it,
backbone po.
ano po?
So you start with the operating system. It's Windows-based. We continue with Oracle as the main database. Sa amin po, sa Waters, Oracle ang main database ng technology. And then we use different technologies according to the company's request. So we utilize Citrix for rendering a client. We use VM for having virtual machines, VMware, maraming klaseng mga VM po pwede. We also utilize the cloud. So meron kami Azure from Microsoft or AWS from Amazon to allow to host the data. So there's so many different technologies. Yun na po, very small amount na startup pa lang. Meron din kami. You don't have to be Windows-based. You can be Linux-based because Linux is very much more secure in the world of Oracle. So we also include that. May Red Hat. Meron po kami. Marami pong possibilities. We don't limit it. We say this is what we've tested. If you want to use something that we have not tested, it's up to you to do the full testing. Pero kung na-test na namin, may confidence kayo na walang problema. Kasi na-test na namin, na-validate na namin na okay siya. Ang kagandahan po sa research, yan po. Kita nyo po, pagka marami kayong mga metabolic data, metabolic analysis na procure nyo, how do you look for each one of those? Sa kung saan-saan kasi everybody has a different notebook. Everybody keeps it in their own computers, all isolated data. Pag ginawa yung lahat nasa isang database, masasearch nyo, alam nyo ba ho, ang daming masasave na time. Because now you can use that data for better analysis and make better predictions. Hindi nyo na kailangan ulitin kasi ang nangyari sa atin na isolated the data, kanya-kanya, gagawin ko to. Gagawin ng isa, ganun din. Hindi nila alam, nagawa na pala. Nasasayang ang oras, ang materyales, ang effort natin. Ang pinaka-importante ang pinakamahal sa atin yung oras ng tao. We're so high in billable kasi our effort, no? Malaking effort yan to prepare all the solutions, to make all that happen, our analysis. Ngayon, lagay nyo lahat yan sa isang database. How easy to see. Ginawa na pala ni comadre doon, o ni kumpare doon, o yung colleague ko doon. Around the world, you can harness. So imagine all these global companies, they share all that data for research. Ang dami pong nasa-save na time. Ang ganda po.
Excellent.
Masaya po dyan.
Thank you, Lisa. Doc, do you have a follow-up question or you're okay?
A follow-up question. So therefore, I'm interested in the Philippine Genome Center, for example. My colleague, Dr. Lakbawan, is now the new director. And one of the things that I learned from Dr. Salome, previous director, was their ability to handle, they were looking for computers and everything like that. So what would it cost the Philippine Genome Center to have a data center that, say, let's go to cancer. Cancer itself. It actually is in the offing because there is a company that Dr. Lakbawan is trying to get into the Philippines to look at the genetic markers that are in cancer. So, question: how much that would cost to set up a connection with waters? To have a database of, say, the cancer coming from Luzon or the cancer coming from the Visayas. Kung sino ba talagang mas may cancer doon, how much does it cost? What is the cost?
Nako, masasabi ko po, ang costing is so variable. It can be so little
Variable.
and yet so large. It all depends on how much data. So ang ginagawa namin, sinescout po namin yan. Meron kaming scouting process. We look at how much terabytes of data are we looking at. We're not talking
I
about
see.
gigabytes, we're talking about terabytes. Hundreds or thousands of terabytes? A million terabytes? Or how much? So if you ask me for costing, nako, malaki pong discussion yan. What we have to do is now talk and look at the actual current data that you have, understand, and in what format. So we have to understand how it could be imported kasi hindi nyo naman gusto i-handwrite lahat, di ba? We want to have it in a format na ma-download natin, ma-upload into the database in a way na nandiyan na lahat ng data, hindi natin, nako, meron ka ma-hire ng mga taong magda-data entry. Nako, mahirap yun. Now, if it was in paper, nako, kailangan ng data entry. Kung nasa digital format na siya, in a way na ma-harness namin, mas madali po. So maraming levels dyan na discussion. How big of a server we need? Okay? How much, which parts of the, kasi yan, kaya yung pinapakita ko, ang daming technologies. Hindi naman ninyo kailangan bilhin lahat yan eh. Kunyari, ang kailangan nyo lang, yung data management portion lang kasi gusto nyo yung gamitin yun. With data analytics para magamit nyo to do that statistical mapping. Mamamap nyo yan, makita nyo Luzon, Visayas, Mindanao, mamamap nyo to provinces kung nandun ang data. All it is entering the metadata as we call. The metadata is the critical part. Kasi kunyari sinabi nyo, gusto kong i-separate yung Luzon, Visayas, Mindanao, pero yung data nyo linagay, walang na indication ng Luzon, Visayas, Mindanao. Hindi natin magagawa yung mapping na yun. So may mapping dapat may metadata ng provinces, may metadata ng entry point ng individual, may age, merong female, male. Lahat yan sa statistics gagawin sa database. Kung nandyan ako sa database, madali na. Kiklik mo lang, gusto ko mag-sort ng by this age range for these females in the country. I-separate a map by province or by region or by whatever po. As long as those metadata is entered.
Just
Kung
one
tayo
last comment.
metadata, mahirap, mag-enter pa kayo, di ba? So ngayon,
Just one
database.
last comment. Oh, these Los Baños people,
Yeah,
they're so smart, ano? Tapos ngayon, lahat yata Filipina scientist, ano? So I'm so proud listening to a Filipina coming from Boston speaking to us. Thank you very much. Those are
Thank you
very
po.
substantial answers. Thank you very much.
I'm so honored and pleased to be invited. Ano lang po ako, BS Chemistry lang po ako. Wala akong PhD, wala akong MS. I'm
Hindi
very much,
bale yan, magagaling pa rin.
nagano po lang ako. When I was starting my career, I didn't know if I want to go chemistry or computer science. Kaso lahat ng friends ko na babae, nasa chemistry. Lahat ng lalaki, nasa comsci. Kaya nag-chemistry ako. But now it's a combination. I did all my Microsoft engineering certification, Oracle certification, para lang widen yung aking breadth of knowledge. Pero salamat po. Ako, I am honored and I thank all my teachers. Nako, yan po.
Yes.
Inspiration po yung mga teachers ko.
Lisa, you've been
Shoutout
inspiring
kay Ma'am Fajardo.
Yes. Lisa, you've been inspiring people here from the audience. So let me call on first Al Serafika, and then later on I'll read a question from one of the attendees. So Al, you're free. Feel free to.
Thank you, Gladys. Thank you, Lisa, for updating our knowledge on informatics. I still remember 35 years ago when I first bought my Shimadzu integrator. to attach to my Perkin-Elmer chromatography machine that's even more archaic than probably some of what you're talking about. This is
Napagdaanan ko po yan.
my New York grad school start in '89. But let me fast forward. We were handling pretty much digital data when I had my own company for submission to the FDA for implant toxicology analysis. This is circa 2010 when we submitted our implant data for a dura replacement device in 2012. My question is of the regulatory experience of using digital data now, how equipped are the regulatory agencies? Like I know the US does accept already digitized data and even stored in the cloud with particular access. So meaning yung mga FDA investigators and approvers can access the data from the cloud and be able to visualize the data submission of the particular company. Ang problema dito sa Pilipinas, I'm not sure we are even capable of accepting digital data for submission. But maybe I'm wrong. Maybe you have a better experience than me that when a multinational company submits their chromatographic data for, say, viability or shelf life testing, does our FDA or ASEAN FDA, I know Singapore does, HSA does, but my question is, do our other less affluent neighbors like Indonesia and Thailand and Vietnam are able to access submissions for regulatory purpose of a digitized data that's stored in the cloud? So in your experience, have you dealt with them where you were asked by a company that you supported, kailangan namin mag-submit, pwede bang gawin to para ma-submit ng ganito? We'd love to hear what your experience in that area is. Thank you.
Ano po talaga, ang digitalization has been the forefront in the US and in Europe. Talagang pong nangunguna yan. Yes, nahuhuli ang Asia. But India is one that's coming to speed up po. China, Japan, and Singapore are very much there po. Because we see our customers are investing into that, lalo na yung mga global companies. If you're talking about, let's say, Pfizer, they have sites everywhere. Ngayon, ikaw masasabi ngayon ang mga Malaysia, Indonesia, Thailand, ang Philippines, dapat tanungin natin sa ating friend, FDA,
Eric Domingo.
Eric, Domingo. Nako, we should have made a chat with him before this. Hindi ko po alam, hindi ako exposed. We also have some colleagues, si Lorente Bonyaga, diba? Tsaka si Pinky Gonzalez.
Yeah.
We can ask them for their opinion, maybe follow up with you. But I have not been involved with discussions with those companies because, as you will understand, malaki ang costing nito. Maybe those companies are not ready to get into that costing. Now, ang nangyayari po, kunyari, ang Pfizer, kunyari lang, may site sila sa isang more third world country, yun nadadamay na sila. As long as maganda ang kanilang bandwidth to get to the cloud, pwede na po. Ang mga cloud services, wala pa po sa mga other countries. Meron lang sila sa mga more progressive countries. So meron kaming hosting ng Amazon. Ang Amazon may hosting, maraming mga hosting yan around the world. Pero I don't know if they have one in the Philippines or Thailand or...
Meron Amazon Web Services here, and actually we're using them for some of our AI developments. Actually, a clear example for me is actually, yung kasabi mo, yung presidente namin sa PAASE, si Gladys. Gladys does metabolomic LCMS data that will support a clinical study for a particular disease or a particular nutritional claim with the regulatory agency. How would she then submit her data, which is stored in the cloud with Amazon Web Services man yan, or Oracle man, or Microsoft man yan, kung hindi marunong tumanggap yung local FDA natin? Then, magkakanda, sayang-sayang, ipiprint pa natin bago, tapos isi-xerox, tapos isasubmit.
Ang kahihiyan po naman ng aming mga informatics products, merong ability to print as PDF. So,
Okay.
ang kaingihan po niyan, yun na po ang delivery method na kagustuhan ng mga inspectors. Because not everybody can actually connect. Meron kaming tinatawag na data sharing so that, for example, I'll give you an example, data sharing in the cloud where a host company and a CXO can look at their same data from two different sites at a certain angle, at a certain type of tunneling na sineset up. Pero yan, hindi widely acceptable to everybody pa kasi syempre yung privacy, very strong yan. Ang integration ng security ng data, very strong. So ayaw nilang ilabas yung data na gano'n. So ang inspector, pag nandyan, usually, ipiprint nila as PDF format and yun ang pa-provide in an email. So kung yan, mababasa nila PDF, siguro naman may PDF readers na everywhere in the nation, siguro naman, ano, di ba kayo, okay na rin po. So, like Gladys will have that analysis, she'll then print off as a PDF yung kanyang report, i-email niya, marireceive ng agency. Hindi ko alam kung okay yun sa FDA ng Philippines o hindi. Pero kung acceptable ang PDF, di okay na.
Okay na yun.
Okay yun.
So this has a comment here. FDA is not yet at that level here in the Philippines of data gathering and analytics based on her first-hand information and interaction with the FDA. Yeah, that's our problem here in the Philippines. We are still, ang daming problema. First is internet access.
Yes.
It's very slow. We have to solve that first. That's why it's connected to the question of one of our attendees here, Verna. Her question is, could the electronic laboratory notebook be adapted for use by university students? Or is it primarily suited for industry and lab settings? Because that's the major problem. What you presented is really good. It's good to have everything in the cloud and then everybody can see it as long as it's secure. And then, yun nga, yung repetition of experiments, that's avoided, right? Repetition of data, that's avoided. But at the same time, we have to have a very good internet connection. So, can you answer the question? Of course, students can use this inside Lisa, remember our pre-lab and post-lab? Ganun pa rin, Lisa, dito sa LB. They have to use the notebook, no? Yung lab notebook. So, can you answer this question?
Sure. So it definitely can be adapted to any setting, including the university. Marami sa amin universities sa States and sa Europe na nag-adapt na ng electronic lab notebook, nag-adapt na ng LIMS system. Kaso lang po, syempre, malaki nga ho ang weight to allow us to have good technology, good servers. So ngayon, kailangan nyo ng mga grant pag university na makabili ng better servers kung i-host nyo. Or to have subscription to the cloud kasi mahal din ang subscription. Diba?
Yes.
So yan, may mga costing yan na mahal. Pero kung merong mag-grant sa inyo sa university setting, invest in it. Invest in better servers. Invest in better bandwidth. Yun ang napansin ko nga dito kasi kaya nga po nandito ako sa bahay ng sister ko. My mom is in the hospital pero ang hina ng signal. Kaya hindi po ako makapag-zoom doon. So I had to find a way to get into a studio setting here. Pero pag merong magandang bandwidth, any organization, kaya po yan. Pag meron silang pera pambili ng servers or meron yan costing ng server, ng operating system, ng lahat ng software licensing or ng ano pa, including pa yung costing ng cloud services kasi magbabayad kayo dyan ng subscription. Yan po ang madadali. Pero kung meron pera, madali po. Sana nga yung buong Pilipinas ma-upgrade nila yung hardware ng ano natin, no? Sana maging
follow-up question.
Gigabit.
Is there an open access, like an lab notebook, online, electronic lab notebook available that's for free that can be downloaded or, do you have an idea?
No, it's not available to have that kind of scenario. So you can experience. Masasabi ko po, punta po kayo sa waters.com/informatics and you can look there. May mga videos kami, ginawa namin mga videos na you can then observe and see how ang application, yung mga learning tools nyo. Punta kayo sa waters.com, punta din kayo sa mga ibang companies na competitor namin. Pero hindi ko na babanggitin yun. Pero once you go there, you see the videos, you see the information there, yun lang po kasi an electronic lab notebook cannot be used independently. It has to be attached to a database. Ang installation po ng aming mga electronic lab notebook, ano po yan, custom built po yan. Meron kaming base, but your metadata will be different from somebody else's metadata. You might be in a lab that says, I need to track the name of the person because it's clinical data, the age. Yung isa naman, laboratory data, kailangan ano. Yung isa naman, kailangan nila ma-analyze yung enzymatic reaction. So ano yung mga, like ang joke ko nga dun sa mga customers ko, what if you need to track the name of the, let's say the monkey or the goat that you're analyzing from for those enzymatic or whatever type analysis kasi in vitro or in vivo, diba? Nag-analyze tayo, baka na-collect nyo. So because of such a variety of metadata, such specificity, we have to customize it to your needs. And your workflow will be different from somebody else's. Your needs, your compliance requirements on how many signatures, when do you sign? Lahat yan, nako, details. So when we actually install, it's not like a cookie cutter. Meron kaming cookie cutter. Pwede na ba yan? Pero sasabihin ng ano, ay, hindi naman ganyan tawag namin, batch number, hindi control number, hindi serial number. Yun lang, nagkatalo na sila, no? Kaya we have to go through and customize it to an extent, to the detail that the customer needs. Kaya wala tayong demo.
Yeah, that's so sad.
Ang
Anyway,
maganda ko dyan, kukontakin niyo ako, I can present virtually and give you a demonstration. So meron ako, wala akong computer dala ngayon kasi bakasyon po ako. Pero pagbalik ko sa office ko, I can show my screen and show you the full breadth of our software. Give you different examples, depende sa...
let's do that, Lisa, follow-up webinar, especially with the students, okay? Already contacted CAMSOC. We will have another one, okay?
Sige.
Follow-up webinar where you give us like a tour of how to, a tour of how to use the electronic lab notebook and how useful it is in terms of data management. Ang saya
Pero
sa
kung kanina nagtanong po si Ma'am Gisela yata po na kung gaano kadali matrain yung mga upper level na dali po. Pag nandyan na po, it's a matter of showing them where to click, you know, where to look at the data, how to search. Yung search bar, malaki. Different choices nila. So it's a matter of what your needs are. Yun lang po yun. Yun. So kami ina-adapt namin yung software na pinakamadali sa higher up kasi sila yung mga decision makers. They want to be able to analyze that data.
Yes, very nice. Very good point when you said that instead of us going to the lab and doing all of this manual, hands-on experiments, we can now focus on the data analysis, right?
In the next steps, kung anong experiment ang gagawin next, yung science mismo ang ating brain work, hindi na yung, naku, namali ba ako sa pag-write ng numbers, namali ba ako doon, kasi kung handwritten 1, 2, 3, 6, 4, ganyan. Ang hirap pag tinitingnan nyo, maraming numero. Ang brain natin, importante yan. Tumatanda din yan. Kailangan i-preserve natin. Ano yung next experiment? Ano yung best trend? Ano yung ating analysis? Para dun tayo mag-concentrate.
Yes.
Or mag-concentrate tayo sa anong lulutuin ko mamaya? Anong kakainin?
Okay.
Yan.
Because we went to Rainfield here in Makati. They have this building, and then we went to their lab. Yeah, we saw this everything is robotics now. So even the pipetting, use everything. So you don't have to do it so that it's consistent. Kasi di ba may human error yung pagpipet
Oo. How fast you deploy,
Yes.
how long you stay, how you tap it para mawala yung doon.
And so I saw the advantage when I saw it, like everything is all automated. So there's
Precision. Ang ganda ng precision.
precision really is not a problem anymore, because when you try to analyze, what happened to this data? You always go back to that question na, is there a human error here in terms of, yung pipetting? So yun, wala na yun. It's already eliminated that possible source of error. So Yeah, so we now go to the next level, not starting from the basic where, uy, mali kaya yung skill ng tao or mali kaya yung calculation of that person. Because there's even an app now even for the calculation of, yung mga solutions, because I have students who have very minimal, background in, preparing solutions, and I'm amazed they have these apps now that they use. Yun nga lang, di nila alam background. But
Oo. Nakalimutan nila yung science, ano? Kung
yeah,
bakit
yeah,
yung calculation. Kasi
yes,
na-automate na.
yeah. Yun lang yung disadvantage. So, but still, we save time at the same time, and then we can move forward to do the analysis. So for the audience, we have this evaluation form that you can now see, and you need to answer this evaluation form for you to get the certificate of attendance. So now let me move on to the next slide, Feb. I think there's no more questions. Thank you very much again, Lissa, for sharing with us your knowledge and your experience. And then I'm so proud of you. Okay. Lissa has been recruiting me since I was a student, but I was so loyal to the academe. When I was about to graduate, she said, don't finish your PhD, apply na sa waters. Anyways, so those are the days. So here, I would like to present the certificate of appreciation. This certificate is proudly presented to Miss Lissa Aspiras Wang for graciously sharing her expertise in her talk entitled Advancements in Informatics during the PAASE webinar series, given this 8th day of March 2024. Signed, yours truly. Again, thank you very much. Let's have a picture, paki-picture, Feb. This not so this is just the start. Please recommend your colleagues so that we can invite them in our webinar series. You already mentioned some possible topics. We'll keep in touch, okay? And then now we can have a photo op from the attendees. Can we have a
Honor is
picture?
all mine. Thank you very much for the invite. Ako,
Yes.
so honored.
Okay. Al Serafika is also a graduate of PAASE. Older lang siya sa atin. Ginanon eh.
Inisto mo pa ako.
Oo. Pero former din yata yun siya. Intern din kasi si Lissa.
Okay. Good job, Lisa. So stay in touch. Definitely, we need to upgrade our researchers here for digital transformation, no? Because
Please
especially with the ongoing interaction, especially with AI, no? With artificial intelligence, the data is the raw material, and if it's not digitized, ay nako, wala mangyayari. So,
Dami ko po makukwento sana pero wala tayong oras sa AI and machine learning.
pag nandito ka na lang sa Manila, ba't tama kami ni Gladys? Maybe we can hook you
nandito
for
pa
that.
siya next week hanggang nandito siya actually nagbabakasyon. So may I request the attendees to open your videos please para naman hindi puro blank ang ating gallery. If you can show your faces please. Ayan. May get together kami with PAASE batchmates Al sa next 15 na, Lissa.
50.
Okay, balitaan niyo ako. Baka maka-helloan ba ako? Pakwento tayo ng sandali. Saan kayo mag-meet?
Not yet sure where, pero sige. Oo. So meron pa ba? Please turn on your videos. Again, thank you. Yes, these are my students and mga KEMSOC to. Which are these KEMSOC? Okay, so ayan. All right. Smile lang ng smile. Okay.
Okay po. 1, 2, 3, smile. Page 2 po. 1, 2, 3, smile.
Elmer, show your face. Thank you. He even asked his students to attend. Oo.
Okay na po.
Thank you, Lisa. Thank you.
Thank you very much. Then next
everyone.
I have some announcements pa. Next na okay. All right, so we have this. So again, as I've mentioned, we have activities every month. So we have our Fireside chat on building Filipino-centered science communities. This is a joint activity with Pinoy scientists. We are all Filipino scientists. We are the older generation, PAASE, and these are the younger generations, Pinoy scientists. So please join us this March 15, 2024, 9 to 10:30. and we'll have a very good discussion on how we can come up with activities and what are the existing activities that could build, science communities. So next slide. And also, yes, we will have, thank you, Doc Billy, for inviting Dr. Ray Pagtahan, who will be giving a webinar on March 22, Medicina at Politica. This is going to be very interesting. So again, but this a little bit earlier, 8 o'clock. Is this the correct time, Dr. Billy? 8 a.m. instead of 8:30? Because usually we do it at 8:30. So that, we want it to be more consistent. So that every Friday we want it to be at 8:30 para if people just they're available, they can just log in. And then at
I
least
see. We will adjust. We will adjust. We will adjust. Thank you.
para,
Deb, take
yes.
note. Okay.
Thank you. And then next slide. What's the next slide? Okay, so I would like to announce our upcoming annual meeting and PAASE Symposium. So for the first time, we will have a 10-day caravan celebration of our 44th APAMS. So we will start in University of Rizal system in Morong, Rizal, and then move on to UP Los Baños, the main event. And then after that, so that's on July 15 to 17. And then we moved to Batangas State University from July 18 to 19. And we end in Eastern Visayas State University from July 20 to 22. The main theme for this conference is Filipino scientists across borders towards developing regional S&T innovation ecosystem. So if you look at the sub-themes, it's all technological innovations with each sub-themes in each site. So we have this call for papers. So the deadline is by the end of the month. Please submit your papers, okay? And then you can also access it through our website, paase.org. We also have, so I would like to call the attention of our students here. We have this cover design contest. So please, there's the guideline. If you have that talent, you are very artistic, we would like to see your entries. We would like to have a cover that is aligned with our theme. So please enter. There's a price of 3,000 pesos. Is that correct, Feb? Okay. Yes, please visit our website. So, meron pa ba? Is that it? Oh, meron pa. Oh, yes. Oh, also, if you're a graduate student, we have this graduate fellowship program. If you submit and then your CV, okay, we have, and if you are accepted, your conference fee will be waived, and you will have a certificate of attendance, and your name will be included in the PAASE directory of graduate students. So please avail of this, okay? And then please submit your abstract because you will be part of the competition for the poster presentation. And after that, if you're a finalist, we will have a chance to present your work. We call it as rapid fire presentation. You just present it for 5 minutes, and then it's followed by Q&A. So please avail of these opportunities. And then the first prize is 5,000. Second prize is 3,000, and for the third place, it's 2,000. Please, again, go to paase.org so that you can go to the links and then use it. Okay. Again, thank you very, very much. Lisa, see you again. Thank you for all the attendees. And please don't forget to fill out the evaluation form if you want to avail of the certificate. Maraming salamat po. Thank you, Lisa. Thank you, Al. Thank you, Giselle. Thank you, Billy. And
Hi,
then,
guys.
thank you, Irene. Ang dami nag-attend kanina. And thank you for attending. My colleagues at the Institute of Chemistry. All right. Bye, Lisa. Bye-bye. Okay. Yes, thank you, Ma'am Giselle. Okay. We'll leave na? Ano?
Will enter po.
Yes. Okay.
Bye po.
Bye.